One of my very most popular videos is if baby has dropped into the pelvis. Today, we're going to talk about fetal lightening, some of the most common questions that you guys have surrounding this so that you can understand it a little bit better and know that if suddenly you can breathe a little bit more, are you going into labor ASAP? Now, these are all questions from the video. I'm going to read it directly from there. So let's head on over to the video. I'll link it up above and down below. Before we get started, make sure that you understand what you want for your birth. I have a whole freebie series called Birth Plans Made Easy. Yes, I love birth preferences, but understanding what you want for your birth is so important, and I'm going to guide you through how to do that in the right way. Totally free. I'll link it down below.
Attention, attention. Paging the pregnancy nurse. She is a nurse, but not your nurse. Thank you.
Okay, head to the questions. Okay, the first one is, this is God's perfect design. And I get so frustrated when I hear those comments. I see them a lot on my page because a lot of people do not experience this as God's perfect design. Many people even have a hard time getting pregnant. And then as we extend through pregnancy, there's a lot of things that just don't feel like things are going perfectly. So I'm here to say that a lot of times things do work amazing. Like, it's amazing how frequently labor and birth works correctly, but sometimes it doesn't work and we need help. So I just want to put that out there. You know, baby dropping into the pelvis usually happens just when it needs to. Again, in that video I mentioned mine doesn't happen for a while, but it's different for everybody. And some people, that baby stays high forever and they may end up needing a C-section. Who knows why? Okay, the next one, they said it was low their entire pregnancy. It was so tough. It can be hard on hemorrhoids, bladder, and can even feel like you're sitting on their head. And yes, once baby drops into that birth canal, it does feel like you're kind of sitting on baby's head. Baby's head is right there. So sitting can be uncomfortable. Again, hemorrhoids because of all of that pressure in that area. And your poor bladder. Your poor bladder is just waving the white flag. So very normal. Once baby drops, you can breathe a little bit better, but the downstairs feels it a little bit more. And be kind to yourself. That is a tough thing. Quick reminder, I actually turned this video into a podcast where I give like an introduction, and I have over 250 other podcast episodes that you guys might want to listen to. I'm going to link my podcast down below. It's great to take me on your car rides or out on a walk or at the grocery store. I'd love to hang out with you there. It's called Pregnancy and Parenting Untangled by the Pregnancy Nurse. The next one is that they just love that I answered their questions, and that's what these videos are here to do. Sometimes you wake up and it feels like baby's dropped and you're like, is something wrong? Why did that happen? You know, you probably don't have an OB appointment immediately. That's why I have these videos to go through what's normal, what to expect, all those different things. I am so glad that you guys are here. Now, someone mentioned that I immediately said that if their baby was breached, that they would need a C-section. I have so many videos on here that talk about your different options if baby is breached, including turning it, aversion. There are tons of different options, but if your baby remains breached, a lot of providers are going to encourage you to get a C-section. You know, hopefully you're watching this video in 5 years and that has changed, but as of right now, that's what ACOG recommends if baby is breached. Now, someone asked, what happens if your baby drops early? Is that bad? Now, that is a great question for your provider. You can say, I feel like baby has dropped. They might want to check your cervix. They might want to do a fetal fibronectin, just see if you're contracting, what's going on. It could be a sign of preterm labor, or you know, if you're still early on, it could just be that baby has shifted position in their womb. They still have a lot of room to move around prior to, you know, the third trimester. So great question for your provider if you think baby has dropped really early. Now, someone mentioned that their baby is so low that they actually cannot measure the baby's head on ultrasound, which that totally makes sense. If baby's head is engaged in here, ultrasound cannot go through this bone. And so they're not really able to measure your cervix or really look that much down below because baby's head is so low. Again, your poor bladder. Now, someone in the comments mentioned that they cannot breathe most of the time. Now, it is normal to be breathless, especially when you go upstairs, or you might just have an average level of breathlessness. But if you find yourself, you know, out of breath suddenly more, or, you know, all of a sudden you're like breathing heavy, that's a reason that you need to call your provider or possibly call 911 if it's a lot. So that's something to watch out for. You know, breathing super important. It can be tricky if baby is still up high, But if you're finding yourself really out of breath a lot of the time, I would talk with your provider. Or again, if it's sudden, call 911 or head to the nearest hospital. This can be indicative of a blood clot in your lungs or something else. So we just want to make sure that you're checked out because breathing is so important. Now, in the comment section, somebody said they're 41 weeks and baby has not dropped. I actually had my last baby at 40 plus 12. So that's a week plus 5 days extra overdue, and my baby still did not drop until right before I had her. I have no idea why they do that. I do know that I have a very tight pelvic floor, but didn't end up having a C-section. She just dropped into the birth canal. I thought she was going to come out my hip, and then I delivered her. So just because baby hasn't dropped doesn't mean that you're going to end up needing a C-section, but it is something that we watch while you're in labor just to see how baby's positioning because it can be problematic, but often isn't. So it's not something that I would worry about. The last one is that they feel like there's a little lightening going on when baby drops. And I think that's totally normal. When baby drops, it can make this symphysis pubis kind of separate a little bit, which can feel like a zap. It might be where it got its name, but it's not unusual to feel that electrical feeling down there. And usually the culprit is this symphysis pubis. Again, if you have any questions, be sure and talk with your provider. Baby dropping can be a surprising symptom, sometimes great because you're like, oh, I can finally take a breath. And again, sometimes bad. I actually have the whole video that these comments are from. I'm going to link it up above and down below. But thank you for joining us here on The Pregnancy Nurse, where we get you prepared, not scared for your upcoming birth and other weird symptoms like baby dropping into your birth canal.